Most headaches are harmless annoyances, often caused by stress, dehydration, or lack of sleep. However, some headaches can be warning signs of serious health issues. In this video, we'll explore 5 types of headaches you should never ignore. Imagine you're fine one moment and then suddenly hit with the worst headache of your life. If a headache strikes out of the blue and becomes extremely severe within seconds, that's a huge red flag. This is called a thunderclap headache, and it feels explosive. This kind of sudden intense pain could indicate a serious problem like bleeding in the brain, for example, a ruptured aneurysm or hemorrhage. In practical terms, it might feel like something burst in your head. If you ever experience a thunderclap headache, treat it as a medical emergency and seek help immediately. A headache isn't just in your head if it comes with neurological symptoms, signs that your brain or nerves are affected. For example, difficulty speaking, weakness or paralysis on one side of the body, vision changes, confusion or loss of balance, along with a headache are alarms you must not ignore. These symptoms suggest that the headache may be due to something serious happening in the brain. For example, a stroke can cause sudden headache with weakness in an arm or leg, or a brain tumor might cause headache with vision or speech problems. If you have a headache and any of these neurological problems, call emergency services right away. Time is critical in such cases. Headaches accompanied by fever and neck stiffness are especially dangerous. If you have a bad headache plus a high fever, stiff neck, nausea, or vomiting, it could mean an infection like meningitis. Meningitis headaches often come with neck pain and fever, and the person may feel very sick or confused. One critical warning sign of bacterial meningitis is a skin rash that doesn't fade when pressed. This may indicate a dangerous infection spreading in the blood. In short, a headache with fever plus stiff neck and especially a rash is an emergency. Do not wait it out. Get medical help immediately. Pay attention to changes in your usual headaches. If you're someone who gets headaches regularly, take note if they start getting significantly worse or more frequent than before. A gradual progression where each headache is more severe or they happen more often is a red flag. For example, let's say you've had mild tension headaches occasionally, but now you're getting daily headaches that are much more intense. That's not normal. It could indicate an underlying issue that's developing, such as increasing pressure in the skull or even a growing mass or tumor. If your headache feels new or different, see a doctor, especially if you're over 50 or have other health problems. Don't assume that it's just stress if it keeps getting worse. Get it checked. If a headache starts soon after you've hit your head or had an accident, take it very seriously. A post-traumatic headache, for example after a fall, car crash, or a sport injury, could mean a concussion or internal bleeding in the brain. Even if the injury seemed minor, a resulting headache might signal a brain bleed or swelling. Symptoms to watch for along with the headache are dizziness, confusion, vomiting, or drowsiness, which can also indicate a concussion or more severe brain injury. In general, after any significant head bump, don't ignore a headache. It's safer to get checked out. In summary, most everyday headaches like tension headaches or mild migraines aren't dangerous, but the 5 scenarios we've covered are major warning signs. A sudden worst ever headache, a headache with neurological symptoms, with infection signs, a changing pattern of headaches, or one occurring after head trauma. These are headaches that require medical attention. Catching a serious condition early can save your life. As doctors often say, it's better to be safe than sorry. For more medical education, make sure to subscribe to this channel so you don't miss any of our upcoming videos. Stay safe and thanks for watching.